Anyway, welcome to the members, invited guests and members of the public, and all those who are watching this on the webcast at today's meeting of the Health Committee. First of all, let me please acknowledge that today is the World Mental Health Day, and that hopefully that we will soon get not only parity of funding but also a scheme of equality for mental health and for physical health. In addition to this, Assembly Member Tom Copley, who's the chair of the Housing Committee, may join us. Well, we expect him to join us later on, but he's been held up somewhere. And this is in accordance with the Standing Order 8.2. And I've agreed that Assembly Member Copley may attend this meeting and participate in a discussion with the invited guests when we come to item number 9. Our main item of today is a question and answer session with invited guests on health impacts on children of insecure housing. We encourage anyone taking part in the discussion on social media to use the hashtag #AssemblyHealth and hashtag #InsecureHousing. First of all, I have a few items of business to go through. Apart from the lateness of so, do you have any other apologies?
There are no other apologies for absence, Chair.
Great, thank you. Can I ask members to note the list of officers set out in item number 2 of the agenda, and also ask members if they have any interest to declare? No? Thank you. Can we note the membership and chairing arrangements for this committee as agreed by the London Assembly at its annual meeting on the 2nd of May 2019?
Noted.
Can we note the terms of reference of this committee as agreed by the London Assembly at its annual meeting of 2nd of May 2019?
Noted.
Can we note the standing delegations of authority?
Noted.
And can I ask the committee to confirm the minutes of the previous meeting held on the 14th of March 2019 to be signed by me as a correct record? Can I ask the committee to note the completed actions?
Noted.
Okay. Can I ask the committee to note the action taken by me as chair in consultation with the Deputy Chairman, namely to agree the committee's report on the heart of the issue,
Noted.
the committee's response to the NHS England consultation on implementing the NHS long-term plan, proposals for possible changes to legislation, and the committee's report on keeping the tooth fairy away.
Noted.
Okay. Can I also ask the committee to note the report and the consultation response, and then note the letter received from the Mayor in response to the committee's report, the heart of the issue?
Noted.
That brings us to the main topic of the meeting this afternoon, which is an answer question session with invited guests on the health impacts on children of insecure housing. And I know that one of our guests, Simone Vibert, is running a bit late because of problems on the Jubilee line, but she says she should be here as soon as possible. But can I please welcome Dr. Amy Clair, Research Fellow of the University of Essex, and Paul Mishkin, Principal Environmental Officer for London Borough of Newham, Stuart Lyons, Director of Public Health, London Borough of Enfield, and Professor Paul Plant, Regional Director of Public Health England, and also Ruth Ehrlich, Policy Officer for Shelter. Welcome to all the guests. We probably will direct some questions at specific people, so we have limited time, about 2 hours, so be focused on your responses. Add in if you think there's some point that needs to be missed by someone. But we will try to ask questions specifically of people specifically. Let me just get some water. So the first question is about setting the scene for the rest of the afternoon. The question is, how does housing quality and residential stability impact on the health outcomes for children? So are more children at risk now than ever before, given the pressure on housing and household incomes? We can start with you, Professor Plant.
Sorry, I missed the
Are more children at risk than ever before, given the pressures on housing and household incomes now?
We've known for decades the link between poor housing, access to housing and health. We know the mechanisms by which that works through, and some of my colleagues will probably go into some of the research. I think the meat of the question was, are they at more risk? We know that there's a fundamental lack of housing for Londoners at the moment, and lots of action's been taken by lots of people. I don't think I've made a particular assessment as to whether it's worse now as opposed to 5 years ago, but we do recognise that it is a fundamental issue, and it's in the Mayor's Health and Equality Strategy because of that, and we might get onto that a little bit later.
Anyone else want to make a contribution to that question?
I can speak anecdotally in that there's definitely more children living in the private rented sector than I noted a decade ago. And obviously the private rented sector is in generally worse condition than other sectors. So, generally the answer would be yes, more children are exposed to hazards in the home.
Okay. And are there marked differences in children's health outcomes according to the tenure of the accommodation? The question is if you have short tenure of accommodation, does it have more impact than if you have long-term stability?
So just to add, in Enfield, I think we've seen, we now have 77% of households in temporary accommodation are families. So that sort of gives an estimation of the numbers of children that might be affected. In terms of health impact that insecure tenure, frequent moving may have, I'm sure our academic colleagues will quote some of the research, but I've read reports in preparation for this meeting, and it relates to a whole series of areas where everything from lack of social connections because of frequent moving, impact on educational attainment, the ability to do homework if you're living in confined spaces. Those sorts of things can have a profound impact across health and well-being generally.
I mean, other looking at some research which says that free people who live in owned accommodation, those children have better outcomes than the children who are going through social sector housing or rented accommodation, and also it depends on the quality of that housing.
I mean, just following the logic of what we know about what enables a child to flourish, you'd expect that any insecurity, any lack of amenity, any sense of social connectedness must have an impact. So I'm not sure academic colleagues will be able to say whether the actual in private rented, because there's some really high class private rented. I think we're talking about a small element of one particular sector, but I'd bow to my academic colleagues as to whether there's some up-to-date information. But as a public health professional, I would absolutely understand that you would expect that to be the case.
No, you go ahead.
We also know that children who are living in owner-occupied accommodation, their parents or caregivers will be spending far less money on kind of outgoings such as rent or mortgage payments. They'll be less likely to move, and the condition of the property is likely to be much better. So naturally, children who are living in either private rented accommodation or in temporary accommodation are going to be in a kind of more stress-covered household. We know that 20% of private renters say that worrying about being evicted affects their mental health, and that's obviously going to have a knock-on effect on their children.
Brilliant. Welcome, Simone. Yeah.
Apologies for my lateness.
No, that's right. No, we understand there was some problem on the Jubilee line. Yeah. And are there any particular socio-demographic groups that are being disproportionately affected by the health impact of insecure housing? In that subgroup of people living in insecure housing, I mean, are there any particular groups that are getting worse off than others?
I think there's a strong case to make that the people who are disproportionately in receipt of housing benefit in the private rented sector are badly affected. They've had to go through the reduction in housing benefit, which we found has had a significant impact on people's mental health. And they're also facing increased difficulty in actually accessing decent privately rented homes, as landlords become increasingly reluctant to accept people in receipt of benefits as tenants.
For those private renters who are struggling to claim enough housing benefit to cover the rent or to find a property that a landlord will let to them, they're more likely to end up in temporary accommodation, being forced into statutory homelessness. And we know that in London, temporary accommodation is often deeply unsuitable for children. local authorities have a duty to make sure it is suitable. But even in circumstances where a household can challenge the suitability of accommodation on the grounds of it not being appropriate for a child's health, they still might just be put on a waiting list to move to further suitable temporary accommodation.
Absolutely, and the process for that can take an incredibly long time to do that suitability review, and as you say, it often ends in something that isn't much better. As well as those families so I'm here to speak specifically about families who are homeless and particularly in temporary accommodation, but in addition to that group, there are nationally, there are 90,000 children living in sofa surfing families we found recently, in addition to the 120,000 or so who are in temporary accommodation. So that's another distinct group we need to think about, who are slightly invisible compared to the other groups as well.
Great. Thank you. Andrew? Sorry, Steve.
Yeah, okay, thank you. Thank you very much. Good afternoon, everybody. My questions are particularly in the context of the local authorities. So really, at the moment, particularly Paul and Stuart, and I speak as a councillor in Croydon as well, so I have some knowledge, limited, on the subject. So I'm interested in your responsibilities, roles and duties. I mean, since 2013, we're only too aware local authorities have a duty about improving the health and have more responsibilities in the health sector. I think that's a fact that we have to deal with. So can you outline on this particular subject that we're talking about this afternoon, the borough's responsibilities to reduce the health impact of families of poor and insecure housing? So from the borough context of Newham and Enfield, can you talk to me a little bit about your responsibilities, how you address those, if you don't mind?
Shall I start? I suppose it's probably arguably 2013 when the public health responsibility moved from the NHS to councils. Yeah. I think you could argue that local authorities have always been doing health in some form, whether that's providing leisure centres or social housing, etc. But I suppose in 2013 it made it more explicit, this public health function. Yeah. But that of course was accompanied by a whole series of system changes, including the establishment of health and wellbeing boards. And they were specifically designed to bring together the whole network, the whole system, to think about the health needs of particular areas and communities within those areas. So I think that's the infrastructure that was provided, and health and wellbeing boards are required to produce a health and wellbeing strategy, particularly designed to address the needs of particular groups in those areas. I think it's probably fair to say that health and wellbeing boards and health and wellbeing strategies are generally quite different in different places, obviously because of the needs of those particular populations. But from personal knowledge, I don't know if housing particularly would appear in those. There might be passing reference to the wider determinants of health, everything from employment and education and transport, etc. And housing is one part of that, which obviously influences health.
Insecure housing in and of itself may or may not feature largely within those plans. That's
right. So although the health and wellbeing strategies are designed to address health inequalities ultimately, there may not be targeted action devoted to housing. Nevertheless, local authorities will have a housing department and a director of housing who will be aiming to address issues around housing, availability, affordability, and quality. Whether the linkage between what the housing directorate might be trying to achieve and what the health and wellbeing board might be trying to achieve may not always be there.
It might just be a happy outcome.
Possibly, or perhaps the more enlightened...
Coincidental happy outcome.
Yes, or the more enlightened authorities may have seen the importance of bringing those together. So that I think is the context. I think that for me, as a Director of Public Health, I would want to use the Health and Wellbeing Board as the main route for bringing lots of this action together.
Okay. Paul, is that your contextual response as well?
As an environmental health officer,
yes, you are.
You know, I'm kind of like an estranged cousin from my public health colleagues, but we come from the same roots, and effectively I'm from the enforcement side of it that has remained in local government since Victorian times. Yes. And so there is a direct sort of legal or enforcement branch of the council within the environmental health teams that directly regulates particularly private rented housing. Now, they sometimes do feed into these other assessments from public health colleagues and health and wellbeing boards, but not as a matter of rule. But So I think there's two different sort of sections,
Yeah.
sometimes working together and other times not even aware of each other. You know, there's the enforcement side that goes in directly and regulates, and then there's our public health colleagues who have a more overarching view.
Okay, let's talk a little bit about the tools that you particularly yourself have, and
Yeah.
you've got as well, that you can address those, which is not just tools that you can use in your own housing stock, how much ever housing stock you have in your boroughs, but also that can reach out into the private renter sector. When you sense that there's issues regarding certain families, you have certain tools at your disposal of sanction to support those. Can you briefly touch upon those?
Yeah, effectively there's a whole legal framework that all councils in England will have that can regulate landlords, and in effect environmental health teams are pretty much the only group that does have those tools or that hold over private landlords. Otherwise it's pretty much a free market and they're free to operate as they choose. Okay. And obviously the market's determined that they can charge whatever rents they want.
Okay. But that's your role as environmental health officer. So you're saying that the levers that you've got aren't necessarily levers that will be pulled by the public health wellbeing board. They would write the strategy about health inequalities. Your department and the way you work will be looking at those actual accommodation that have issues and using the levers. Would one of those be licensing of private tenants in your boroughs?
Yeah, well, it's more licensing of private landlords to ensure that the landlords are regulated. But yeah, that is one of the increasing levers, certainly across London. And I mean, it can tie in with public health colleagues, but generally they work more closely with like housing colleagues and even working with like the police and so on.
I mean, we've got in our briefing here, we said that the councils have powers to issue civil penalties. Yeah. And can ban landlords and do all sorts of things.
Yeah. So that has been a useful development because, number one, the income comes straight back to the council, so we can fund ourselves effectively through rogue landlords paying these civil penalties.
I mean, on that particular point, the briefing I got, that August paper, The Guardian, had an FOI saying that no landlords had received a banning order. So, I mean, is this something that you want to use that power? If you can?
Well, we have issued one just recently, although it's obviously challengeable. It's still at the point where it could be appealed. And I think a few councils are starting to use them now. Right. But it comes back to the same issue that you probably hear, week in, week out. It's about resources, the number of officers in place to, use the good tools that are there. It's a question of...
I mean, we'll probably get round to asking what other tools and other things you need from the mayor to help you. But what I'm sensing is you Paul, for Newham and your post and your department, you're pursuing the environmental issue. You'll hear about families and accommodation that's not fit for purpose, and you take sanction. But the overarching health piece doesn't really seem to be looking very pointedly at health issues for young people.
It may vary, of course, right. But I don't think housing features hugely in many strategies, health and wellbeing strategies. But having said that, different authorities will be taking different approaches, and a phrase that you may be familiar with is health in all policies, or HIAP for short, which is a method by which you look at everything, all the activities and functions of a council, and consider what health benefit can be gained from each of them. And so when working with housing, for example, you might be thinking about smoke-free tenancies or designing in play areas to encourage physical activity and reduce smoking in the home.
I would also say that part of our judgment or assessment is looking at the health impact of the poor housing on the occupants.
Okay. I'll sit back now, and I think Andrew wants to come in.
Just a clarification from Mr. Lyons. You said that housing does not feature in many health and well-being strategies.
This is my personal this is a personal view. I think health and well-being strategies largely focus around it's a bit of a generic formula, and Paul may comment too. But you will have they will broadly talk about healthy start in life, or healthy adulthood, or healthy aging, and that's the broad framework quite often. But depending on the needs, of the specific needs of that area, that geographical area, you will focus in on particular areas.
So this is the health and well-being strategies are the ones developed by the boroughs, aren't they?
Yes, well, in partnership with the CCG.
With the CCGs. Yes. And from
your
experience, there's not a lot of housing in there. The reason I've come back is that astonishes me, if that's the case.
Well, this is my personal view, but Paul may.
So I think we need to make a distinction as to whether action is being taken as opposed to which strategy and which group of officers are taking it.
Yeah.
And I think what I observe is action is being taken, but colleagues would only work together operationally when there was an operational issue. But I've never spoken to any Director of Public Health who doesn't see the link between inequality, housing, and poor outcomes.
Well, yeah, that's why I asked the
It's-
question,
so,
because
you know, so-
it's a given that housing is a key
Sitting
issue.
across, I mean, we sit and interact with all 32, and I've never ever come across anywhere which doesn't, a person who doesn't see that link. But in terms of Paul's operational day job, might not need a public health specialist to tell Paul what to do or how to do his job. He just gets on and does his job.
Yeah.
The work gets done. So not seeing it in a public, what are we going to do together strategy is not an indication that it's not serious and nothing's been happening.
I understand that, but you haven't allayed my concerns. But thank you for that.
Yeah.
I'll finish, Chair.
Thank you.
Yeah, thank you, Chair.
Yeah, well, over to Joanne.
Can I just start with Paul? We know that over the last 10 years, environmental health budgets have been reduced by over 50%, so half have been cut generically. Has that limited your ability to do the amount of inspections you could do?
I would say that that cut has been sort of offset by these new civil penalty notices or financial penalty notices, which effectively can fine a landlord for not improving a property or not complying with conditions of their licences. So that comes back to the authorities. So in my branch of environmental health enforcing in housing, that's certainly in Newham, that's not the case, because we've kind of got a cushion of this funding of licence fees, penalty notices and so on.
Okay, thank you for that. And I want to ask then about how health services and local government could actually better work together. And I think Paul and Stuart, you've talked about strategies and the actions maybe happening despite a strategy, if you like. What could be put in place to make sure that the two of you are more working more closely with your other departments, whether it's housing or education, but particularly housing for this issue?
Shall I start? I think the Health and Wellbeing Board, as I mentioned, is a key partnership forum. But local authorities do and always have done work with all partners through different routes. As a Director of Public Health, I interact with our local clinical commissioning group, CCG. Again, looking at what the priorities are, what we can do to improve services, but also thinking about what services can do to improve action on prevention generally. We also have the new NHS long-term plan, looking at the whole development of integrated care systems. And I know that the integrated care systems are, because they're designed to be taking much more of a population health management approach, are considering all these wider determinants of health. Again, that might look different in different places according to the stage of development, but I think it's important to recognise that these NHS plans are considering the wider determinants, including housing. So I think there's a willingness and a keenness from the NHS to engage more with local authorities specifically on this. Now, perhaps it's still early days, but I think we're still developing what that might look like. In local partnerships.
I think that's very positive. I suppose the question is, what stick do you have to make sure that action is then taken at local government level, whether it's environmental health stepping up the amount of inspections they do, whether it's more say on new developments, making sure they are actually healthy places for our children.
Do you mean to answer that? So a number of you may have been in this room a week ago when we launched the London Vision, where there was that sense of, there's some fantastic examples of that word integration, but we know that there's not enough places doing it and it needs to go faster. So that was saying, here's a commitment that at a neighbourhood level, we need to get better at doing this. And then at a borough level, we need to get better at doing this. There's a commitment that this is how we're going to come together to enable that to happen. pragmatic. So there's that long-term commitment from the senior leadership to investigate and ensure and enable that to happen. The areas where it's evident, but I think what happens, which is a sort of at the core of what we're talking about, is there enough supply out there, or if there's enough housing out there, that if you are looking after people with severe and enduring mental health problems, this will be a key issue for you. Because if you get hospitalised and you're in temporary accommodation, you've got a real problem about maintaining rent and keeping your house to go back to. So when the community mental health teams engage in this, they have real time, today, this afternoon, somewhere in London, somebody will be having to manage all of that. So operationally, the health service really does have this at the heart of particular vulnerable groups where they need to look after them. So in lots of these areas, it's not that professionals have turned a blind eye, don't know what to do. It's often an issue of resourcing, and on a Friday afternoon when you've got to find some accommodation for somebody, where do you go? So I think what we're trying to do is solve how do we use our collective resource more appropriately? How do you reduce the barriers for that integration? Recognising, and I think the question was, with diminishing resources, is that ever going to fit?
Okay. Well, representing Enfield and Haringey, I'm aware that Enfield has one of the highest eviction rates from private rented accommodation, and both Enfield and Haringey, along with Newham, are the highest areas for children who are in temporary accommodation and therefore moving. So I'd like to widely talk to the wider panel about what could be done to make sure that this system between health and local government is stronger and does alleviate some of those pressures. Stuart, you want to come back first?
Just before we move on, I just wanted to also just point out that there are a range of services which do, in the context of children, which we're focusing on, would interface with children in temporary accommodation. So obviously social workers, and there's a whole safeguarding area, so alerting if there's any issues and concerns, health visiting, for example. So the join up on the ground between social care, the NHS, is there, I would say. Yeah. But I think you're thinking about system-wide. Yeah,
and what we can do to stop or reduce those numbers of moves, the rates of eviction and so forth. I don't know if everybody else wants to come in.
From a temporary accommodation homelessness point of view, a key problem I would say is moves out of area and what happens then. So local authorities are meant to notify each other, when families are moved out of area. We know they often don't, and I think the Local Government Association is doing some work around this at the moment. But what that means is sometimes you get really highly vulnerable families moving away from their social services, the other services they're receiving, into areas where they become completely isolated. So interestingly, there's actually a specialist health visitor team in London that works focus primarily on families who are homeless, and they say they often they have walked into families before, into new families who have moved into an area, and they have no idea they're even on a child protection plan. So that's the degree to which it can really break down when things move out of area. So that's the first thing I'd say. The second thing, and I think, again, this is a very homelessness point of view, kind of take on it, but there's a particularly vulnerable group of families, and it's the same sort of group I've just described, actually. But it's those who are being housed not by the housing department, but by social services under the Children Act. This is a group of families who they might have been found intentionally homeless, so they don't have the same rights to housing from local authorities, who are completely invisible. There's no data shared about them nationally. They are often, as I said, the most vulnerable families, and we don't really know anything about them. And I have real questions to ask about what happens to those families and whether the services they receive are joined up at all. So that's just one. I think we'll probably return to that point, but yeah.
Yeah, absolutely, and I'm glad that you brought up children's services. I think it's really important. It's another group that's deeply affected by that is families who have no recourse to public funds, so they might also have serious problems in accessing healthcare or other kind of vital services. And these families who are accommodated under the Children Act also don't have any right to statutory review, so there's no kind of guideline on what their accommodation should be like. So they tend to be living in often completely inappropriate circumstances, and already they're extremely vulnerable households. Just thinking about the other things, minimising moves, for example, in boroughs where there are high rates of eviction. Obviously, there are lots of things that can lead to eviction, and kind of nationwide problems like welfare reform has meant that it's much easier for families to be evicted. But touching on environmental health, you obviously do incredibly important work for households living in poor conditions. The Deregulation Act of 2015 was meant to prevent revenge evictions, so stop families who've complained about repairs to their private landlords then being served a no-fault Section 21 notice. The level of evidence means that you have to have a notice served by environmental health. We find that in our services that most people try and resolve a problem with their landlord straight away, or otherwise they might contact the council but not be quite sure about the right avenue to go down, and so by the time environmental health have even thought about coming out to visit, they actually will have already been served a no-fault revenge eviction notice. So that's something that obviously the Mayor has been working on with the London model, and scrapping Section 21 and no-fault evictions will be vital in ending that practice.
I mean, I want...
There's an inherent unlevel playing field between landlords and tenants, and that's essentially what fuels it. So the no-fault Section 21 notices, there is no comeback for that, and these retaliatory eviction powers. It needs that knowledge from tenants about what their rights are.
So come on to that, I think, in a little while. But one of the good things that Enfield has recently announced is they're going to bring back their residents who've been put into temporary accommodation outside the borough, which is really welcome. But can you envisage that creating issues again with the shortage of accommodation in the borough?
It's probably not an area I can comment on particularly. I know that there are plans underway to ensure that this can be done, because that is the strategic aim, to bring people back to the communities.
Thank you. Can I ask perhaps Paul to start with, do you think that GPs are fully aware of housing as being an issue in poor health and are able to signpost patients? I don't know if this comes under social prescribing, or because I think all of us who've been counsellors in the past are quite used to people come to surgeries with poor accommodation. They've got the doctor's note that says it's exacerbating their asthma, but you are aware that when you send it in with a pleading letter, that actually whether it's going to make much difference, and whether there is other things that perhaps could be done in the meantime.
I think it'd be a sweeping statement to say all GPs or no GPs. We've got some fantastic primary care. So in one sense, yes, there will be a tail end of primary care practitioners who aren't in an integrated service, who are not working with other colleagues, who are just stretched and resort to a sort of a biomedical, use your 8 minutes and pass it on to somebody else model. But I don't think that is modern medicine, and I don't think that's modern primary care. But you're asking me for an overview of the whole of London. I'm sure you probably know more than I do about your own patch as to where those GPs are. I think standing back, I think the city still has a problem with poor quality primary care in some areas, and I think we've been explicit at that. And I think in the London Vision last week we were explicit that actually it's not just the GP, it's a wider team, and they're often operating out of poor premises, and that's why there's a whole bit in that vision about getting better on integrated estates with local government, which is an interesting model, because when we were debating that allows that integration to happen, because there's more people in a particular place for which a person can immediately go and talk to, rather than you do your primary care here, and then you have to travel 15 minutes to somewhere else to talk about it again. But I don't have any data as to whether, what percentage would I say don't do that. I think strategically, if anybody does it, then it's wrong, and can we sort it out? But I think that's what the very local will have to be doing in their patch, and it's the sort of thing, Stuart and all of the other directors of public health will be at an operational level trying to sort that out.
How are you doing at it?
Well, I think variability in primary care has been it's a historic issue. Whether you're a diabetic patient at one practice or another, you may well get different levels of treatment, and we probably know that happens. And so the degree to which her GP may be tuned into housing conditions, they may well know that dampness will lead to an asthma or exacerbate asthma, but what can the GP do? So there's that question. But on an encouraging note, just going back to the Health and Wellbeing Board and the system changes within the NHS, the recent creation of the primary care networks, PCNs, are, I think, a real opportunity. So just in Enfield last week, we had a Health and Wellbeing Board development session, and we had the 4 clinical directors of our primary care networks, who are GPs, engaging with the Health and Wellbeing Board for the first time, really interested in the health needs of at that population level, the whole borough level, and their sort of PCN areas in particular, and are interested in these wider determinants, which obviously include housing. So those connections, I think, are being made at that level, which I think is really encouraging.
And just finally from me, do any of you, can you give me us examples of good practice where this proper integration is really working?
I know of example. Tower Hamlets is often talked about.
So Sam Everington's work in Tower Hamlets, you've probably had him here before. That in terms of Bromley by Bow has been going for a long time, because what we talk about, we go from the sort of strategic and the abstract into real people's lives on a Thursday afternoon when something has to be done, don't we? You know, that's basically the issue where it goes wrong. But I haven't looked particularly on that issue. So, but I'm sure there are. When I go into meetings, people say we have a good example of social prescribing. You know, people come in, they get triaged. They get supported through a range of issues, not just housing, but whatever is the underlying issue for an individual or their family. That's happening, and the GLA has just pushed out a sort of a strategic document of how we grow more social prescribing activity. And the NHS long-term plan is funding some of those link workers to make it the health professional who is strapped for time, that you actually have somebody attached to your practice whose job it is to know what to do, whose job it is to link with the local charitable sector. And so the health professional doesn't have to hold all of that knowledge all of the time. Within the practice, they have the link worker who will then do that. So I think that's strategically really important, because wherever I go, everybody says primary care should do more of this, they should do more of this, they should do more of this. And when you add it all up, it would be impossible. And actually what Stuart's talking about is a new model with a new set of resources which recognises these issues but gets terribly practical. That's where we're heading.
Thank you.
May I just take up one thing? Miss Ehrlich said that you said welfare reforms have made it easier for families to be evicted.
So,
could you expand on that?
Yeah, absolutely. Looking at the freeze on the local housing allowance in particular means that there's often a dramatic shortfall between the amount of housing benefit a household can claim and the actual rent. So we see people trying to kind of make up the shortfall either through subsistence benefits or by cutting back on essentials. So we know that 19% of renters here, they've been forced to cut back on things for their children. That's anything from leisure activities to food. And more than 1 in 5 renters have made cutbacks on food for themselves and their partners. So for us, that is a clear indication that people are unable to pay their rent, even with the kind of welfare that's meant to be there for them, which is the housing benefit for the private renter sector.
So this relates specifically to the freeze on the housing allowance?
Yes, exactly. So that's why we are calling for the local housing allowance to be unfrozen and then raised back to the 30th percentile, just so it covers sort of the bare minimum rents in an area.
Thank you very much. Thank you.
If I can ask you, Simone, it's a question about children's centres. So clearly they play an important role in supporting families to deal with everyday issues such as housing and health. But since 2010, it is estimated that around 1,000 of these centres have been closed in England. So what evidence is there, if any, of the impact of these closures on the health outcome of children?
So I don't have any specific evidence on the link between the closure of those centres and the impact on health outcomes. Something I would say that we're really thinking about at the office is it's sort of something slightly different to children's centres, but it's the idea of extended schools. keeping schools open before the typical opening time, after in the evenings, at the weekends. That's something which has been thought about before by the DfE and others, and that's, we think, a really good opportunity. If children's centres aren't where the zeitgeist is at the moment, that's something that we could be thinking about, and that would be a very good place, I think, to have something like housing support there as well. You know, schools are everywhere. They're built for children, they're built for families. That's a really, you know, if children's centres aren't going to be somewhere where we put resource anymore, that is a good option that we're really excited about at the moment, that lots of people are talking about. So I don't have any evidence on that, but I think there is somewhere where we can go that would have a sort of children's centre function that is more promising at the moment, I think.
Fine. So, yeah, here what you say about extended schools and all that, but just to ask you very specifically, although there's no direct evidence that you're aware of linking the closure of children's centres,
I don't know any.
but
I can
clearly the concept of children's centre is important, and in your opinion it would help.
I mean, obviously we need the impact on early years of poor housing is particularly profound. So, for example, the specialist health visitor I spoke to, who I told you about earlier, she described a family, you know, we know there's many, a family living in a single room where the child had sort of developed a kind of attachment problem because they were always in sight of the parent at all times. So the idea of even taking that child to nursery was going to be extremely problematic for the child. So I can't speak to the closure of children's centres, but I am concerned about the impact on very young children of this issue.
Thank you.
This was a question which were for Tom, but I'll take them. This is to look at particularly more about housing standards. A question for Ruth and Amy. What more can be done by central and local government to improve housing standards and security of tenure in the private rental sector? For example, extending landlord registration schemes or licensing property MOTs. This is sort of thing which we put forward to us. But what do you think can be done more by central and local government to raise these housing standards?
I think the clearest thing is going forward with the abolition of Section 21, because it's all well and good to talk about redress for private tenants, but if there's a risk of them being evicted for complaining, then there's no point in having those protections. For standards, we've obviously, the Homes Fitness Human Habitation Act was passed last year, which is brilliant, but it's very difficult for people to enforce those rights. There's firstly the risk of being served a Section 21 eviction notice, and it's also extremely difficult for families to have access to legal aid to challenge their landlords in court. So we need to just strengthen, I think the key thing is strengthening security in the private rented sector would be our main call.
To add to that, as well as abolishing Section 21, I think we need to look broader at trying to somehow ensure housing affordability, because although Section 21 enforcement might end, if landlords are able to put the rent up as much as they like at the end of a tenancy, they can effectively evict people at the end of that tenancy anyway. So something needs to be done to ensure that people can stay on in their accommodation if they wish to.
Can I just ask, the government's just announced that they're going to abolish Section 21. But doesn't that cause problems for some of the temporary housing providers, people like Centrepoint, for example, who provide accommodation on a temporary basis for those people wanting to get back into the community, because they rely on Section 21 in order to vacate those properties after a period of time?
So there are a few things so the government is consulting on how to abolish Section 21 at the moment. The consultation closes on Saturday. So there are lots of things that need to be worked out. I'm not sure how Centrepoint, if they use licences or short-hold tenancies, and it would obviously depend. Licences are still going to be issued by certain providers. They're two different tenure types. And then I think an important thing to remember with Section 21 is that there will be grounds for possession for private landlords and other providers to be able to regain possession in legitimate circumstances. So as long as you have a reason, you'll still be able to get the property back.
Yep. Do you think that's going to have an effect on the supply of housing?
Our feeling is that it will not have a dramatic effect on the supply of housing. We hear a lot that landlords will leave the market, and landlords leave the market every year and then they're replaced by other landlords. So there's always all kinds of movement in and out of the sector. as long as Section 8 of the Housing Act is amended so that it's workable for landlords and tenants alike. I think this is just a way of rebalancing the relationship between landlord and tenant rather than creating an unworkable system.
Probably won't result in more people wanting to provide housing, though, will it?
You can still make a profit from renting out houses, so
Okay.
there always be some interest.
And landlords quite frequently will issue what's called a licence rather than a tenancy, even though in law it is a tenancy, because then it gets around that sort of perceived problem of having to issue a Section 21 or a Section 8. So although it's not correct, some landlords are already, issuing licences rather than tenancies.
That's illegal.
That is illegal.
Yeah, right. Nobody wants to do illegal stuff. Thanks very much. Thank you.
Well, thank you. And should more be expected from industry, I mean, from landlords and agencies and other lenders to help us address this problem? I mean, can we do, I mean, we talked about what the government and what the local authorities can do, but what about the industry itself? Can they do more?
Well, I think mortgage companies, when they issue, buy-to-let mortgages, I don't think there's any stipulations about compliance with minimum housing standards. It's more on the financial transaction side of it. So they could be encouraged to draw their clients' attention to those minimum standards, because a lot of landlords enter the market without real knowledge of what it is to be a proper professional landlord, and this can result in some of the problems that arise.
And this is perhaps somewhere where letting agents could play a role, because you've got what's often called amateur landlords, but letting agents, I think, are in a difficult situation. They are paid by the landlord, but interact with the tenants. So if maybe letting agents are empowered to have a bit more of a standard maintenance role, perhaps, rather than being at sort of the mercy of the people that pay them directly. It's potentially a role for them there, a supportive role.
That'd be useful, I think. Andrew.
Thank you. Can I just ask, for example, Mr. Mishkin, to what extent overcrowding is a problem for young people's health?
It's a very big problem. It can have a wide range of long-term impacts, the impacts on mental health and also physical health, cross-contamination from various, completely unsuitable number of households occupying, just box standard 2-storey mid-terrace properties with a family in each room. So there is evidence around the impact of overcrowding on health and also mental health, educational attainment. So it's relatively clear to see that these situations have a negative impact.
Is that something, Mr. Lyons, that you've seen in Enfield with regard to overcrowding?
I couldn't give any specific examples, no, apart from sort of the general understanding about what the impact might be. Those issues that Paul has just mentioned are accurate. I've read research that suggests that children are at a higher risk in overcrowded environments. Also the risk of, I'd add to the list, accidents and hospitalisations, just simple home safety in the kitchen or stairways, that sort of thing. And possibly also a link in terms of mental health. We talk about the mental health of the child, but also the impact of mental health of the mother, maternal depression, etc., living in difficult home circumstances.
And that, is it likely that people who are in insecure housing are more likely to end up in overcrowded conditions? I don't know if Ms. Ehrlich has got anything to say on that.
So I don't understand.
Whether or not people who are in that category of being in insecure housing, are they more likely to end up in overcrowded conditions, or are they more likely to end up in underoccupied conditions?
So, although I think more people living in the social rented sector are overcrowded, and that's obviously in part because you're more restricted in your moves, we know that it's a big problem in the private rented sector. About 25% of private renting households are living in overcrowded conditions. Another big problem is overcrowding in temporary accommodation. So thinking about the ways that impacts on children, I've got some kind of examples from our services that demonstrate the impact on children of all ages. A woman living in temporary accommodation with a child, a toddler and a newborn, they were living in one small room, the kitchen and bathroom upstairs. She was unable to go upstairs to cook because she couldn't carry all her children at the same time. So there was never any fresh food for the family. Babies with no floor space when they're trying to learn to crawl, which is obviously stunting a key developmental stage. For adolescents, it means no privacy if they're going through puberty, nowhere to study for exams. So I think the impact of overcrowding, although it's spread across different tenures, is significant on children at all stages.
I've heard the figure, and I just don't know if anybody can confirm this, that there's about 350,000 young people in London being brought up in overcrowded conditions. Does anybody recognise that figure as... I know overcrowding figures are quite difficult to okay. Professor Plant, what has the Mayor done to address issues of housing quality and instability and the impacts on children's health?
So in terms of drawing out what we're sort of talking about today, so the link between health inequalities and housing is drawn out in the Mayor's health inequalities strategy. So it is central to that sort of concern. It's Objective 6. And the way in which the Mayor and the GLA have operationalised that is obviously through the role, responsibilities and resources they're putting into housing. So it's not really my... we made the link, we said this is the link, this is what you need to do. I'm not in a position to say whether the Mayor is actually... the performance in that, I think it would probably be also for the Housing Committee, wouldn't it, to do that. But what I am aware of is, so in that strategy, and I think Stuart mentioned this sort of health and all policies, we did draw out the links between the need for more affordable homes, the improving security of tenure, so this was it's in there as a sort of a key interlink, the improving the quality of homes, and there's particular action around fuel poverty and how that's interrelated, cold during the winter, although I think also increasingly with summer, poor quality housing is also difficult to maintain adequate temperature. There's work making the link with the wider GLA family with temporary accommodation, and you notice in the London Vision we're picking that up in terms of rough sleeping. I know that's slightly different to the conversation here, but that gets picked up. And also colleagues in the NHS are making this commitment to use redundant NHS land in terms of an estate strategy. So strategically, we've made the link, and there's that. In terms of getting into the operational detail, it's not my role, and I don't have that detail here, but we did make the link. And I think, draw the analogy earlier between a health and wellbeing board linking health and the wider the council thing, activity, that's been done strategically, so we have made those links.
As a part of that health inequalities strategy, was there an identification that overcrowding was an issue and a factor in...
I think at that strategic level, yes, there were those debates, which is it's part of the overall, there is a lack of housing, meeting a growing population, meeting poverty and inequality. In essence, as a public health professional, I didn't need to go through the detail because we knew what those interlinks would be. And we also know from lots of evidence how that mechanism works for both a child and a family. We know the mechanisms. So yes, we made the link.
So with that link, and I take the point that you're not responsible for any other strategies or actually putting that into place, but it's strange, therefore, that if that link was made in the inequalities strategy, that the Mayor then abandoned his target for reducing overcrowding in his that would be an odd thing to do, would it not?
Like I say, it's not for me to say what the Mayor does when he integrates the strategy.
Ms Ehrlich, don't you think that would be an odd thing to do, to abandon overcrowding in your housing strategy?
I would have to have a look at the strategy, I'm afraid.
Sure. I mean, the Mayor's also abandoned the target for family housing, the number of family homes, and the Assembly has recently, a little while ago, unanimously decided that they wanted to see more family homes, but that's been abandoned in the Mayor's strategy. Do you think that's carrying through on the health and inequalities strategy?
You're asking me to make an assessment on...
Well, you would have thought that if you'd have identified overcrowding in the health inequalities strategy, you would have expected there to be some action being taken in order to address that.
So I'm not going to be drawn on the Mayor's housing strategy.
Would you have expected there to have been some action being taken in order to take some action about the problem with overcrowding and its effect on inequalities in the Mayor's strategy?
I certainly think it's important that councils are able to build homes that local people need.
Absolutely. And you would want to address overcrowding. Is that something Shelter, certainly in the past, Shelter has been quite big on addressing overcrowding?
Yeah, we think that everyone has the right to a safe, secure and affordable home, and that includes one that's appropriate for their family size.
So how would Shelter feel about it if, for example, we see last year the number of family-sized affordable homes fell in real terms from 23% down to 10%. How would that address the health inequalities of those people living in overcrowding conditions?
I mean, Shelter's clear on our position that we need to build 3 million social homes over the next 20 years. That needs to be in cities and in rural areas and everywhere that people need family homes to be built.
So it'd be quite worrying, wouldn't it, for the terms of health inequalities?
Your leading questions, Andrew.
They're my questions. It would be quite worrying, would it not, if, from Shelter's point of view, to learn that in Richmond and Merton, not a single home of 3 bedrooms or more was started during the last year, while in Westminster the total fell from 48 3-bedroom plus homes down to 3. Would that be of concern to Shelter?
Any lack of genuinely affordable social homes is a concern to Shelter, which is why we have our campaign to build 3 million social homes. So we want to address the reasons why councils aren't able to build local authority homes and make sure that every Londoner and everyone else in the country does have somewhere to live.
Thanks very much. Professor Plant, how is the Mayor ensuring a cohesive approach to reducing health inequalities across all his areas of responsibility, so housing, education and crime?
That's a big question. It's the whole strategy. I think we've got a session on the inequality strategy coming up, haven't we? So there is a health team here, which is making sure that health in all policies is being taken forward. Myself and colleagues and wider partners are involved in that. It was a central question in terms of what the health and care sector is adding to that bigger strategy, which is what you heard at the launch of the London Vision. So what we're doing is recognising that people have multiple responsibilities on multiple spatial levels, and actually to take action it's that coordination which is required, and that's what you've got from the London Vision Partnership to say we will hold that and make sure that there's that sort of integration. I think recognising that in terms of, you mentioned education, the health service doesn't have very much persuasive ability on schools, if you talk about schools, or if it's DFE, that's a national level. So when you do public health, there's always an interface with multiple agencies at different levels. And I'm clear that the right conversations are happening to make sure that in our plans at both the local level and at a regional level, that core of what should we be doing, how should we be doing it, is running through the conversations.
So the strategies seems to be there. Could you expand a little about what the London Vision Partnership is doing?
So I mean, the actual London Vision will report to the London Health Board.
Right.
So chaired by the mayor, it's got 5 local authority leaders on it, it's got NHS leaders there. That will be the coordinating mechanism and accountability for the partnership to voluntarily come across together to take action. So that's where it will happen politically across the city. Below that level, all the senior people in the sector are talking and work together. And what we're doing now, having published the London Vision, is for each of the areas of work to work through into detailed operational plans. So childhood obesity, air quality, adolescent mental health, adult health, rough sleeping, end-of-life care, dementia. Each of those have coalitions of work. You know, we can't, it's the way the city works. You know, you've got local authorities with different governance. You've got city with a different governance. You've got a National Health Service reporting to Parliament. What the London Vision is saying is, as collective leadership, we have a role and we are coming together to organise how we take action at scale.
You've mentioned as part of that the childhood obesity strategy.
Yeah.
When are we going to get some KPIs on the childhood obesity strategy? Because there aren't any.
There's some set out in the vision. And so...
Well, there's a lot of, just to put it in context, there's a lot of talk about childhood obesity and how it's a terrible thing, and and we all agree with that. But there appears to be very little in the way of practical
we
things.
can look at the inequality strategy. This is about housing.
It is about housing,
And
but
not
it
about
was
obesity, right?
raised by Professor Park. So I'm just following up on what
I think we will get up to look into these.
I don't quite understand. So in terms of, if you want to talk about childhood obesity,
you're citing that.
6,
You're citing that as one of the things that the mayor's doing, and I'm just saying, if the mayor's serious about all these strategies, he's serious about this, then presumably there's going to be some KPIs. I'm just using the childhood obesity strategy as an example of where there are no KPIs whatsoever.
No, there are.
There are KPIs.
Yeah, we measure childhood weight at reception in year 6. We measure it every year. Results come out every year. We know every single school. We know precisely what we're doing.
As a part of the strategy. That feeds into KPIs on the strategy, does it?
That's what we measure, because that's what we've got.
So you've got a starting point and that you've got an ambition to achieve an end point, and you can measure the performance of what the mayor's done as a result of those.
So you keep talking about the mayor. The mayor has some responsibility, but not all responsibility. He has some things.
I'm talking about the bits that he is responsible for.
No, he's not responsible for... We're all responsible for childhood obesity.
Mm. But
he's an
important partner.
Yeah, absolutely.
Yeah,
and
absolutely.
he's taking action. So, and behind the scenes, we've got the NHS taking action. Every single borough is taking action.
Good.
PHE,
so how do we measure that action? How do we measure the action that has taken place and the results that have been?
We're going off, but in childhood obesity, it's the most measured. I can tell you every single school in London what's happening. So I don't understand the question, because we measure it. It has if we want to talk about childhood obesity, there's multiple reasons children are overweight, which require multiple actions.
I don't want to talk about childhood obesity and the issues that I'm doing. What I'm trying to understand is how the mayor is measuring his successes with his ambitions, because he might say he wants to do such and such, but unless there's a measure for it, how do we know whether or not he's done it?
I think it's a different view of a strategy.
Sorry?
I think it's a different view of a strategy, because different people have a contribution to make.
So the strategy...
he measures his, but he couldn't possibly be responsible for healthy life expectancy, for example, which has multiple...
I mean, it's a multifactorial thing, right? And you must accept that, right? And there's a lot of partners who are working in it. It can't be all the mayor, and we all have aspiration that
the mayor comes up with discrete strategies, all of which feed into for the subject matter we're talking about.
But in the health inequality strategy, they set out a set of KPIs for which we're going to be tracked over time. They are in there.
Could you send me the KPIs for example, for the childhood obesity strategy?
He doesn't have a childhood.
So he doesn't have KPIs for a strategy he has.
I think we'd talk about different things. If you want to talk about childhood obesity, just briefly, colleagues. So the Mayor has a task force who came forward with a set of recommendations about what different people at different levels should be doing. That is being considered, in which the Childhood Obesity Task Force set out what they thought should be the ambition. But it included action by the NHS, by PHE, by local government, and that is being considered. Because who are we going to hold what to account for? So if the Mayor's contribution to that is fast food advertising on the TfL estate, there will be some way of measuring what the impact that has been, but tracking that through down to how many kids in Enfield are now overweight or obese would be very difficult. So that's
a KPI, that's a performance indicator.
We do that. We do that every Wednesday. My whole team look at data for the whole
So all
city.
I'm asking is send it to me, what that KPI is.
That's what I'm struggling. I'm struggling with the it. I'm struggling with the it.
Do you want to know the figures?
Yeah. I mean, if you put in a policy, if you want to put in a policy and you want to achieve something as a result of that policy, and I fully understand, and we can have a long discussion about childhood obesity.
I think we're talking
surely we want to measure the impact of that policy.
But that's.
I haven't seen any KPIs on health.
Okay. But look, I think Professor Plant has given the answer best he can.
We have. You have.
Thank you very much. And I think we need to leave it at this. And I think we're going to come back to housing, and we will look at obesity and other things at other time. But now is not the time to do it. Thank you, Professor Plant, for your input.
But thank you.
Did you want to come in on this?
Not to prolong that, but purely.
I was trying to get us out of this pothole
purely just to help show how things connect up. So the overarching health inequalities strategy for London is a useful document to have if you're sitting in a London borough. You can point to it and look at good examples and ideas and what you can do. And so when we develop our local health and wellbeing strategy, childhood obesity in Enfield is a huge problem. So we do have a series of metrics, things like schools participating in healthy school status, or numbers of participants in the children doing the daily mile. So we have those sort of process measures which all contribute, we hope, to reduction in childhood obesity at the end of it.
You've got KPIs.
But yes, locally.
You have. Can I see those?
Yes.
Thank you.
Told you shouldn't have come in.
Okay, so in the public health outcomes framework, there's 68 KPIs. We can send them to you.
Thank you.
Thank you, President. Thank you. Just to come back to housing, okay. Professor Brown, what evaluation? I mean, this is about evaluation. What evaluation has been made of the impact of Mayor's programs to reduce poverty in households and children? Has any impact been made of those? Have any assessment been made of that?
I'm not sure. I don't know. That's an academic question as to. I don't know if colleagues have.
So was it with an evaluation of?
Yes.
Of
the Mayor's programs to reduce poverty in households with children in London?
Oh, in London, no. Sorry, I don't know.
No. Okay. Thank you. Were there any other questions relevant to housing? No? Okay. Well, look, first of all, I want to thank you for all your contributions this year. If you think that you've got to say something to us, we wish you had said it to us, or something comes to your mind afterwards, please feel free to write in to us and contribute. We will still love to hear from you. But formally for this evening, for this session, I think we can leave it here. Unless you want to add anything at this very moment. Was there anything that you thought you wish you had said you hadn't said, or a question we wish we'd been asked that question?
Well,
yes.
Probably could talk all day, but I think the links have all been mentioned. The link between health, poverty and housing tenure, that's the strong links between each. In terms of health, we talked about the myriad of health effects that there are from mental and physical.
Yes.
But a group that we haven't mentioned today were adverse childhood experiences, ACEs, which really captures all the negative impacts that children might experience throughout childhood, and where they grow up is obviously a key impact on that.
Which we could, but just one more question whilst GPs were brought into conversation. I'd love to know the answer to this question. When I write letters to the housing department, does it make any difference at all? Because I get the idea that my letters often go into a filing cabinet below the desk, right, which is round in shape. But does it have any impact at all, people?
Definitely does have an impact. So
Yes.
we shelter services work really closely with lots of primary care providers, and we obviously have kind of a mixed experience.
Yes.
But whenever we do speak to GPs, we always give really clear guidance on what we need from a medical letter.
Yes.
Because often GPs will write something that's useful in medical terms, or even just for another layperson,
Yes.
but in order to meet the criteria for a housing move, it's not quite right. So I think that we can, Shelter is definitely trying to kind of do some more general working with CCGs to make sure that doctors do have guidance on how to write compelling medical evidence. The thing about it not feeling like it makes a big difference, sometimes it really does make a difference. Sometimes it will lead to a positive decision for the client or the service user, but they will then be put on a waiting list to be moved somewhere else, as we talked about earlier, which is obviously really upsetting for everyone involved. And at other times you have kind of local authorities might have their own medical departments who will outsource medical assessments. So GPs might write in, but actually then a homeless applicant has to undergo a different kind of private medical test. So I think there's definitely lots of work to be done, but the work that
for example, our borough says don't write in to us unless we ask you for a letter, okay? Then you have patients who come and say, we've been to the housing department, and the clerical officer sitting there has said, get a letter from your GP. So they're in that dichotomy. But I think that's a problem which I often face.
It is worthwhile because, as Joan and Ongra say, sometimes when I've recommended to people, go and get the medical letter because of your child's asthma, blah, 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 there's a little bit inside of me that thinks, this is never going to get anywhere.
It's always worthwhile. I think the key thing is making sure that the letter has the information that the local authority needs.
I think you're from Shelter, aren't you?
Yeah.
I think you can do something very useful is write to all the GPs in London, right? Say, when you write a letter, right, the following information is important, right? So that we all know what to write and how to craft the letter.
Yeah, and that's what we do with all of our clients who come to us. We'll send them to the GP with a letter, a kind of covering letter. But I think we can do some more work.
You could be wider, do a London-wide thing, right?
Exactly.
Send all the
Yeah,
GPs,
I think
right?
that would be a really useful.
That would be a very useful thing. I mean, I certainly would find it very useful, rather than the letters of prose I write. I could write something much more factual, much more useful. Great. Thank you for that. Okay. And so, can I thank our guests for the contributions, and finally can I ask the committee to note the report in the subsequent discussion and delegate authority to me as chair in consultation with the deputy chair to agree any output from this discussion. Can I ask the committee to note the progress of Honest Work Programme and the topics agreed by the GLA Oversight Committee on the 1st of July 2019 for its meetings from July to October 2019. The next meeting scheduled for this committee is on the 6th of November at 10 a.m. in the chamber. Noted? There's no other urgent business, so thank you.
Thank you.
Well done.
GLA Chamber Sound. 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 GLA